Okay, so right, so we're here today to talk about mental health in the workplace. Starting with a question that a lot of businesses have, or certainly HR leaders. What are most businesses doing wrong when implementing mental health support for staff?
I think this is a really, really interesting question. And I think one of the reasons why we get asked this question a lot is what happened when workplace mental health became a thing 7 years ago now. So 8 years ago, nobody was talking about mental health in the workplace. Once it actually became a thing, um, the role and responsibility to look towards tackling stigma in the workplace, improving mental health and well-being was really given to HR leaders. And as you can imagine, HR leaders, the majority of them had no previous training around mental health, have had
Yeah,
no expertise or previous experience of looking at behavior change, tackling stigma, and understanding, mental health and the impacts that it has on people and
yeah,
businesses. So what happened was a lot of HR managers were really just doing what they thought was the best thing to do.
mm,
And what we've also seen in this field is there is a lot of noise, but very, very few experts with a background in understanding mental health and well-being and behaviour change.
yeah,
So what happened was we saw a lot of organizations take more of a bottom up approach to mental health in the workplace. We also saw initiatives being implemented as more of a tick box
yeah,
rather than taking a strategic approach to it.
yeah,
And what that really essentially created is when we understand health behavior change, and we'll all understand this from our own perspective. We've all
yeah,
at some point in our lives looked at a part of our health and well-being, thought, I should really be making changes to that.
yeah,
However, somebody telling you that you just need to lose weight,
mm,
get on a diet, is not going to make you lose weight and get on a diet. We
no,
know how to lose weight, but actually, that actions for behavior change are much harder to do.
mhm,
So, the way that we look at behavior change around health and well-being is how do we prevent it from happening in the first place? So, this was a big gap that I suppose a lot of workplaces were not aware of, that they
yeah,
had a legal obligation to do this. Um, and they were focusing only on the individual. They were really only focusing on providing employees with the information to understand their mental health and look at ways that they could look after it themselves.
mm, yeah,
So when you're just
yeah,
focusing on an individual, it doesn't really look at the impact and implications of our environment,
mm,
our sex, our gender, the information that we know, the
yeah,
support that we have in our workplaces,
mm,
the social norms that are connected to mental health, the way that policy in our communities and in the workplace impact mental health and well-being as well. So there are a lot of intersections that we need to look at as a strategic approach if we really truly want to make improvements around mental health and well-being and change behaviors and create a culture change. So the question about what workplaces doing that was particularly wrong was starting with an individual approach,
yeah,
wasn't looking at how do we prevent work related stress.
mm,
How do we look at ourselves as an environment that might be impacting on people's mental health and well-being,
yeah,
and also just focusing on the individual. It almost kind of puts the blame on the individual and says, this is up to you to make these changes,
yeah,
and weren't particularly looking at how we can provide that additional support for people through things like manager support, employee peer-to-peer support, EAPs, if people were struggling, stress prevention, risk assessments. So what you can start to see is this tick box approach actually started to create more problems.
Yeah.
One of
Yeah.
the things that this also created as a problem was raising awareness at an individual level, at employee level.
Mm.
Is brilliant. This is more information for you to better understand how you may be experiencing poor mental health. These are
Mm.
the signs and symptoms, the impacts that it might have. But if they haven't trained managers and leaders and don't have safeguards in place to support people, once they go, oh gosh, this information you've just given us, I think I am struggling with my mental health and I do need the support.
Mm.
Managers are not then equipped to support that person
No.
appropriately. They don't have the skills, the confidence, the behaviors to have those conversations and put support plans in place, do stress risk assessments, if it's
Mm.
work related stress being the cause of that. Um, Senior leaders, managers haven't really tackled the issue around stigma,
Yeah.
discrimination. So then they haven't created almost a psychologically safe workplace where they're able to disclose if they're struggling and know that they're not going to be treated discriminatory
Yeah.
or see negative impacts of disclosing that they're struggling with their mental health. So this tick box approach has actually created more problems than what we were trying to solve in the first place. So tackling
Yeah.
stigma, building trust, helping people to be confident in supporting employees in the workplace really needs to take a top to bottom strategic approach. So I
Yeah.
think that's where some of the problems have um, have been created from, and we've seen that through some of the research. We're not really seeing a huge uptick
Mm.
in people being more comfortable and confident
Yeah.
talking to their managers if they are struggling with their mental health. So even though we're saying we're trying to tackle stigma, we haven't necessarily done it in the right way to
Yeah.
see a big uptick in a change in that. I think one of the other things that has happened that has also created more risks, which I know we're going to go into more detail about,
Yeah.
is mental health first aid approach.
Yeah.
So, mental health first aid training originally originated in Australia in 2001.
All right.
And it was in response to a survey of findings that were showing that poor mental health literacy among the public was, really, really quite poor. So it was designed for anybody in the community to attend a 2-day training course that gave you higher levels of mental health literacy. We're able to better understand signs and symptoms connected to the medical model around
Yeah.
mental health. What is depression? What is anxiety? What is bipolar disorder? And also provide them with some strategies that they could use if they came across somebody in the community who may be presenting with some of these symptoms of
Yeah.
poor mental health or displaying suicidal thoughts and behaviors, so that there could be an intervention.
Mm.
Now, in the community, brilliant. Yeah,
Yeah.
being able to connect with someone, a friend, a family, a loved one, even just somebody out in the street who you've come across who you're really concerned about. It's potentially given you the confidence to do that. But also, this is what really was shown through the mental health first aid research that Mental Health First Aid England did was it was more around the individual literacy. People were
Yeah.
then more literate about their own mental health and what they could do to look after that and access support if they needed it.
Yeah.
But if you came across somebody in the community and you used your mental health first aid knowledge and skills, you could potentially support that person in the
Mm.
moment, walk away and never ever see that person again. Yeah.
Yeah.
Bringing that training into the workplace is a
Mm.
completely different ball game.
Yeah. Yeah.
So once you were in a workplace, you have governance, you have legal compliance, you
Yeah.
have policies, procedures, um, health and safety guidance that really needs to be part of anything that you do in the workplace. So, what was initially happening was, and it's still happening today, we are still seeing that this is a massive problem for a lot of workplaces.
Yeah.
A lot of workplaces invested in mental health first aid training. They trained lots of people to be mental health first aiders.
Yeah.
So now you've given these people an actual role with a
Mm.
responsibility without recruiting them safely, without
Yeah.
giving them governance, infrastructure, additional support, monitoring them, reviewing the service that they're doing. So, what this actually created then was risks. This was
Yeah.
now creating risks. So, the 2 day training course that was implemented was a tick box approach.
Yeah.
Had a very, very small outcome from what that training was providing for people. But what workplaces were trying to do was fit a 2 day training course into this whole peer to peer service that was
Mm.
then being provided and saying
Yeah.
to their peers, if you're struggling with your mental health, come and speak to a mental health first aider without any
Yes.
of those safeguards and governance and reviewing and monitoring in place. So we
Yeah.
then began to see these really, significant risks.
Yes. Yes. Which we'll
So
talk about more in the next section.
exactly,
Yeah.
yeah, exactly.
Yeah.
So yeah, these really are, I think, some of the biggest pitfalls that we've seen over the past 7 years,
Mm.
and why we've specifically seen these pitfalls at our Minds Work is our background is health and social care.
Yeah.
Our background is understanding behaviour change, how to help people to change health behaviours. And it's not as easy as just giving people mental health awareness. It's
Yes.
not as
Yeah.
easy as just implementing mental health first aid, which is,
No.
again, very reactive.
Yeah.
People are not really signposted to mental health first aiders unless you're already struggling with your mental health in the first place.
Yeah. And for that,
So,
you've got to be comfortable saying I'm struggling, or
yes,
somebody's got to visibly notice it.
yeah,
Um,
yeah, yeah,
and a lot of people will hide signs that they're struggling.
yeah,
And without everything around it,
yeah,
people aren't going to be using that service, are they?
yeah, yeah. So, mental health first aid, um, training on its own is creating risks.
Yeah.
Mental health first aid implemented as a peer-to-peer support initiative that is safeguarded, it's got governance, it's monitored, people are provided with support, it's reviewed, it is safeguarded from those risks,
Yeah.
is still just part of a wider strategy.
Mm. Yeah.
So when we look at a strategic approach, and I know we've put our strategy framework um, into this model here, is what we can see is it's just a layer of support
Yeah.
and really one part of an initiative that would fit into a wider mental health and wellbeing strategy. But it
Yeah.
also has to be implemented in a really safe, safe and monitored way as
Mm.
well.